The coronavirus is spreading, Pakistan being the latest to declare its first cases, and so is fear of the unknown. As governments urge people not to panic, there are the visible signs of it across Europe. In the empty supermarket shelves in northern Italy, in the hotels locked down and quarantined, in the sporting events and public gatherings cancelled. China remains the epicenter of the disease, with nearly 80,000 cases reported. But for the first time, new cases outside the country have exceeded new cases there. South Korea has the second largest number, with over 1,000 infected. In the Middle East, Iran still has the most cases, with others in Bahrain, Iraq, Kuwait and Oman. And now the first reported case in Latin America in Brazil. In Europe, Italy has the greatest number of people infected, with nearly 50% more cases reported in 24 hours. Several other European countries have announced their first infections, including Greece. In Tenerife, 4 cases have meant hundreds of holidaymakers are unable to travel home, whilst here, of the thousands tested, only 13 have caught the virus. Our international editor, Lindsay Hilson, reports on the global spread of coronavirus.
Praying for the sick is a medieval ritual, but this virus is spreading by thoroughly modern means. Those at the Pope's Ash Wednesday audience today are amongst 50 million people who fly in and out of Rome annually from more than 230 places worldwide. Pope Francis says he feels close to those suffering from the virus and those who care for the sick. His doctors might advise him to limit contact. Older people and those with underlying conditions are most at risk. On the high-speed train from Rome to Milan, everyone is aware that there have been more than 370 cases and 12 deaths in Italy. Part of a trend in which, according to the World Health Organization, the number of new cases outside China now exceeds those within. Milan itself is very quiet, as the authorities try to balance sensible containment with preventing panic.
Bisogna essere tranquilli.
We should stay calm. There is no reason to be particularly afraid. As a doctor, the only advice I can give is to tell people who are more at risk, the elderly, those with pre-existing conditions, cancer or weak immune systems, to avoid going out.
A WHO team is preparing to travel to Iran, where the authorities may have underreported the outbreak centered on the holy city of Qom. A statement from one of the shrines today said the material used to build it would deter the virus, a kind of magical thinking that may be less than helpful. This report went viral. The journalist says the situation in Qom is critical. They don't have enough doctors or medicines, and he begs the authorities to close off the city, even if it means food shortages. Next door in the Iraqi city of Najaf, they're worried that Iranian pilgrims will bring the virus with them. But they're also worried about no pilgrims coming at all because they depend on the income. Falling ill or losing your livelihood, what kind of choice is that?
The number of Iranian visitors had exceeded 4,000 people per day, but now there is not a single visitor here and all the hotels are empty. Our major concern as hotel owners, and Iraqis in general, is the absence of a health infrastructure. The Iraqi health system is broken.
The empty hotels of Najaf are the least of it. Container shipping from Asia to Northern Europe is down by about 50% since the virus emerged. That's a massive economic hit, not just for the shipping industry, but for Asian suppliers and for manufacturers elsewhere in the world.
From import of raw materials into China, there's been obviously a massive decrease in that because the factories have stopped or are just starting to recover now. So, and on the finished goods side of it, you've got empty containers, for example, in China, and you've got a shortage of containers in the States because the manufactured goods are not getting out of China and being transported around the world. So it's affecting all the supply chain.
Air travel is down too, as people cancel or postpone trips. Good for the planet, maybe. A drastic way of reducing carbon emissions that no one could or would have planned. All over the world, they're disinfecting. Classrooms in Bangkok are getting the treatment. Trams in the North Korean capital, Pyongyang. Buses in Seoul. The WHO has not declared this a pandemic, saying that could amplify unnecessary fear and stigma, but it is encouraging such precautions. In Dublin, they've postponed the Six Nations rugby fixture between Italy and Ireland at the Aviva Stadium, one of several international sports events being delayed. And in the Philippines, they're sprinkling ash instead of smearing it on the foreheads of the faithful, avoiding contact. The head of the WHO said today that we can contain the virus, but the impact of the measures required is being felt across the world.
Lindsay Hilsum there. Well, here the Health Secretary, Matt Hancock, told MPs that a wider public information campaign will be rolled out, insisting the government had a clear plan to contain, delay, research and mitigate the coronavirus outbreak. Several schools have been closed across the UK after fears that children returning from skiing trips to northern Italy might have been infected. But what is the official advice? Here's Simeon Brown.
For hundreds who work here with Chevron, the morning memo was work from home. As cases of COVID-19 build around Europe, Britain is bracing itself. Today the government said they expect to see more cases here, but refused a shutdown of schools, calling it unnecessary.
If anyone has been in contact with a suspected case in a childcare or an educational setting, no special measures are required while test results are awaited. There is no need to close the school or send other students or staff home.
But some schools have done exactly that. Cranley School in Northwich has closed its doors this week after students with flu-like symptoms returned from a trip to affected regions, like here in northern Italy. In an age of global tourism, COVID-19, commonly called coronavirus, has an international passport. So travellers from affected regions, those tested or been in close contact with somebody tested positive, have been told to self-isolate. Public Health England say hundreds of people have already successfully done it. But what does it mean in practice? The government say it means to separate from those you live with, including your partner and children, in a private room with the door closed. If you can, use a separate toilet and bathroom. If not, have a rota and clean thoroughly after use. The advice also suggests ordering food and groceries using online services. Only visit a doctor after a phone call, and as standard, wash your hands regularly. The problem is that for those returning from outbreak zones like this, self-isolation